Good evening, and welcome to our first virtual mental health symposium. My name is Daryl Beebe, and I'm the Director of College and Career Readiness and Social Emotional Learning for the Wayne-Westland Community School District. Joining me this evening is my co-host, Amanda Dybus, Supervisor of Family and Community Engagement. Tonight's discussion will be on the critically important topic of suicide prevention. Information shared this evening may be sensitive, especially to those who have had a recent loss or experience with suicide. Please be mindful of this as we move forward through the evening. Amanda?
Thank you. Tonight's virtual symposium is sponsored by the Rotary Club of Canton. The Rotary Club of Canton has been working with our mental health task force around suicide prevention, and they recently wrote a grant to help support this work. In addition to this symposium, they also purchased materials recommended by Wayne-Westland Community Schools mental health staff to support mental health libraries, which are located in all of our school buildings. They also help develop materials around suicide prevention, which will be located in all school buildings for parents and guardians to access.
This evening, we'll be having a discussion with mental health professionals, including panelists from Wayne-Westland Community Schools, Beaumont, Hagera Health, and the Rotary Club of Canton. Later this evening, we'll be answering some questions from our audience. Please feel free to submit questions anytime using the chat box, and we will answer as many questions as possible at the end of the discussion. As therapists and mental health professionals, we often use very clinical language when talking to one another. Lisa Kennedy is going to be one of our non-clinician panelists this evening to make sure our language is understandable and understandable to all that are involved. So at this time, I would like to invite Lisa from the Rotary Club of Canton to share what Rotary does for the community.
Thank you, Daryl. Canton Rotary is a local club comprised of business owners, retirees, and other community members that want to do service above self. That's our motto. Back in the day, we were responsible for starting the Canton Public Library. And most recently, we've worked with the Canton Community School District on a security project. We are part of an international Rotary clubs, which is 1.4 members worldwide in 150 different countries and 46,000 different clubs. So we're trying to eradicate polio, we're fighting disease, we're doing clean water projects, and just a number of other service projects. So feel free to check us out at rotary.org. and cantonrotary.com. Thank you.
Thank you, Lisa. Next, we would like to introduce the panel for this evening's discussions. So from Wayne-Westland Community Schools, Jerry Zeider, school psychologist. Jerry has a double master's degree in school and community psychology from Wayne State University. He has been a school psychologist in the Wayne-Westland Community School District for 19 years and is currently on the Central Evaluation Team for Autism and is a lead member for the district's Mental Health Task Force.
Also joining us this evening from our district is school social worker Amy Coatsworth. Amy has been with our district for 2 years, working with our alternative education and early childhood populations. She received her bachelor's degree in social work from Wayne State University and her master's degree in social work from the University of Michigan. Prior to coming to our schools, Amy was a medical social worker at Michigan Medicine, and also at a smaller agency in Detroit, serving patients age 0 to end of life.
From our Beaumont Child and Adolescent Healthcare Center, Lisa Kennedy, clinical social worker. As a clinician, therapist, and the manager of social work at the Beaumont Child and Adolescent Healthcare Center at Adams Middle School, Erin has dedicated her career to addressing the mental health needs of children and families. Erin is especially passionate about suicide prevention and helping students and families in crisis. From Hagera Health Incorporated, please welcome Kelly Mays. Kelly Native Child Mays is a licensed counselor and community outreach coordinator at Hagera Health, specializing in suicide prevention. She is also a domestic violence activist, author, spoken word artist, and webcast host. She received her undergraduate degree at Central Michigan University, her Master's of Science in Counseling at the University of Phoenix, and is pursuing another graduate degree at Central Michigan University in education with a focus on training and development. Some of her accomplishments include 2021 Employee of the Year at Hagera and Humanities Champion of the Year, Individual of the Year 2022 Humanities Award.
Thanks, Daryl. And Kelly would just like us to clarify that her Humanities Award is a nomination and those awards will be announced next week. So we are rooting for you. Next, from the Rotary Club of Canton, I want to reintroduce Lisa Kennedy. Lisa has been a member of the Canton Rotary Club for 25 years. In that time, she has served as the Area 5 Assistant Governor, Club President twice, Club Secretary, Club Board Member, and is currently the Community Service Chair. In her personal life, she is married to Michael and is the managing agent for Kennedy Namir Insurance Services in Plymouth. Lisa has sadly lost loved ones to suicide and brought the call to action to her club to try to make a difference. Welcome, Lisa. As we start this evening, we would like to share a video of a grandfather, Patrick Koenig. Patrick lost his grandson Clay to suicide 6 years ago. He would like to share his personal experience with you.
So Clay he just turned 21, so he just got out of school a couple years earlier. He worked with his dad in the family business. He lived with me during his high school years for about 2 or 3 years, and was always kind of bright. But he was very bright. He loved doing family things with us all the time. We have a cottage. I owned the bar, and he had him bussing tables and stuff like that. Really didn't notice anything different. I mean, his growing up was pretty normal, but he lived with me for 3 years. I never saw him mad. Never saw him be picked on or anything else. He was pretty normal, and never saw anything like this coming. None of us did. It's the most devastating thing you can ever imagine. I can remember getting the phone call, and actually it was kind of ironic because a couple of my kids that lived out of state were actually in town. And when we got the phone call, it was like 3 o'clock in the morning. And the effects were absolutely devastating. We were numb for days. He lived in Wisconsin at the time and was, like I said, working with his father. And just crushed us all. So when we went to the memorial, because it was so strange that this had happened, I kind of, wherever his friends were, I kind of hung by them, not with them, but by them to see what they were saying, because none of it made sense to us. Just to see what their ideas were and what they were saying about the whole incident. And they were as shocked as we were, because all they said was he was the funnest guy to be around. If they were going to get together, if they knew Clay was going to be there, everybody wanted to be there. And so you're looking for something, and to this day really found nothing other than the fact that he had a fight with his girlfriend. And it still bugs us to this day.
How do you move on, or are you able to move on?
We've been able to move on with our golf outing that we do in his honor, the Clay Ryan Memorial. We started that golf outing after he had passed away. We always did one at my bar, but it was just for fun. So we made it a fundraiser for suicide awareness and prevention. There's things that you learn through talking through people, changes in their attitudes and stuff like that. Like I had a good friend recently, his daughter went into college and was having a rough time. And just the simple little changes that you see, pay attention to it, because they could be reaching out. And she ended up seeking help, and she's doing great now. But I would say, just from my experience with kids, they want to talk. It's when they don't talk that you have the problem. And to let them talk is probably the biggest gift you can give them, because otherwise they're holding it inside and they have no way to deal with it. They're trying to do it by themselves. They need help.
Wow, that was powerful. Our deepest condolences and sympathies go out to Patrick and his family. Patrick shared with us that this was his mission, to share his experiences so that no other grandparent or parent has to go through this kind of loss. So we thank him for being open and sharing his story with us. And at this time, we'd like to open up the discussion with our panel members. So I'm going to start with Kelly from Hagera. So my question to you is, will talking about suicide put the thought of suicide in someone's head?
Thank you, Daryl. That's a great question, and actually a very common myth that people have, that talking about suicide or asking someone about it will encourage suicide attempts. And actually, talking about suicide provides the opportunity for communication. It can make that person feel relieved. It can reduce anxiety. It also can normalize the conversation. We talk about that a lot. You hear that a lot about normalizing conversations and normalizing it, but it can normalize that conversation about suicide. Fears are diminished. Someone is encouraged to take the first step towards transitioning out of that suicide crisis. So just a simple inquiry about a suicide and where that person is at in that space can mean the first steps to helping save someone's life.
Thank you. So as a follow-up, what are some risk factors that parents and guardians should look for with their child? And part two of that, what is the difference between a risk factor and a warning sign?
So risk factors vary from person to person, from demographic to demographic. Some common ones for kids can be things like bullying, rejection from peers, social isolation, family violence. Also, losing a loved one or someone close to them for suicide can increase risk. Trauma, childhood abuse. There are many risk factors, and I do encourage people to research more or to talk to a trained clinician or someone specializing in suicidology. American Foundation for Suicide Prevention, afsp.org is a really great resource to look at risk factors. Now, when you're talking about risk factors and warning signs, risk factors are things that are already present to make that person at risk for suicide. So things that already exist. So if that person has a history of trauma or a history of mental illness or a history of exposure to bullying, those things are present. Warning signs are things that people observe. So what kind of things are you seeing? What kind of behaviors are exhibiting by that person? The gentleman in the video talked about isolating themselves, or someone not enjoying the things they used to, changes in mood and behaviors. Those are things that you're seeing, warning signs that that person may be at risk. Maybe someone giving away things, prized possessions, obsessed or talking about death, whether they're posting videos, watching movies, writing about it in poems, or listening to songs about death. So those type of things that you observe that are not their normal behavior, or they're not their baseline behavior.
Thank you.
And this question is for Erin from our Beaumont Clinic. Erin, what are, again, some of the warning signs that parents and guardians should be looking out for in their child?
I would, so some of the warning signs that really I see a lot of at the clinic, I'd say majority of the children that I see are referred from the medical staff. So they're coming down with consistent stomach aches, headaches, just medical complaints, we call somatic complaints. This is their feelings of suicide, their feelings of depression. This is manifesting into stomach aches and headaches, and it's the only way they know how to verbalize it. That's where, with younger kids, we're going to see that a whole lot more. With the older kids and even the younger kids too, you're going to see this isolation, as we talked about, the withdrawal from things that they would normally love to do. Maybe they don't want to play soccer anymore like they enjoy. They don't want to hang out with their family anymore. The tricky thing is that you might think that is somewhat typical for teenagers, right? They're growing up, they are becoming their own. But again, this is why we need to be listening and talking and asking those questions, because they might be fine, but they also might be thinking about suicide. You can hear, one of the more obvious things is when you hear your child talking about death or dying or really hopeless statements. I'm never going to feel better. I'm never going to be good enough. It's always going to be bad. Not eating, not sleeping, or sleeping too much. These are those, the sleeping and eating too much. I mean, that's our foundation. We can't get better if we don't sleep. We can't get better if we sleep all the time, and we can't get better if we don't eat. So we really have to look at those holistically as, this is a big problem and a big warning sign for suicide. Also, risky behaviors, maybe drug use, alcohol use, reckless driving if they can drive, things that your child normally wouldn't do. Maybe they're a little more easygoing and all of a sudden doing these really risky behaviors. But again, like Patrick said, sometimes you're not going to see any of this stuff. So as a parent, trust your gut instinct. And if your gut instinct tells you something is wrong with your child, get them some help.
Thanks so much, Erin. Our next question is for Jerry, school psychologist from our district. Jerry, can you explain what students and parents can expect if they do call the National Suicide Prevention Lifeline?
Sure. So the National Suicide Prevention Lifeline, you can reach it at 1-800-273-TALK or 1-800-273-8255. It's available 24/7, 365 days a year. The National Suicide Prevention Lifeline phone number is also printed on the back of all of our student IDs in the Wayne Westland Community School District for students in grades 6 through 12. So when somebody calls the Lifeline, they will hear a pre-recorded message, and it will explain that the hotline is also a supportive line for the Veterans Crisis Line. There's also an option to hear instructions in Spanish. The call will automatically be directed to a suicide prevention responder located in the state of Michigan. So it's a nationwide number, but based on your calling, where you're calling from, it will direct it to a local provider. The approximate wait time is about 2 minutes until a suicide prevention hotline responder is actually on the phone with the caller. There is a recorded message that indicates that the phone conversation will be monitored and recorded. It's not required that you share your name or location with the responder, but you are free to share any information that you wish regarding your situation that you're in. At the end of the call, a safety plan will be developed between the caller and the responder. So a safety plan is a document that supports and guides someone when they're experiencing thoughts of suicide. So it helps them avoid a state of intense suicidal crisis. At the end of the call, if there is still need for more information or further assistance, the responder will direct you to call 211. So Michigan 211 is a free confidential service that connects people with local community-based organizations across the state. And they offer thousands of different programs and services for people seeking assistance.
Thank you, Jerry. I want to go to Kelly from Hagera again. Okay, so if my child has made a threat to harm themselves, what do I need to do in order to get them seen by a mental health professional?
That's a really great question. The first thing I want to kind of touch on is when your child is making those type of threats, to take them serious every time. I often get a question when I'm doing suicide prevention training, whether I'm talking to parents, educators, or even clinicians about the seriousness of threats. Someone could threaten suicide 10 times or threaten harm 10 times and not do anything. On that 11th time when they do it, they might do an act of self-destruction. So each time take it serious. The second thing is there are lots of resources available in Wayne County, specifically for children. So, and you have to access them, unfortunately, access them through the ER, except for one, which is the Children's Center. They have crisis services. I believe they cut off the crisis services around 8 o'clock. But you can go there and you can access those crisis service, have your child screened. If that child's already seeing a clinician, definitely contacting their clinician and talking to them, or contacting their primary care doctor and discussing with them and planning, safety planning, as Jerry mentioned, because that's really key and really crucial. But taking that kiddo to the ER, they will get someone to come in and screen them. Right now, I believe New Oakland is the screener for Wayne County. They come in, they send a clinician, sometimes a peer support person. They conduct an assessment, and then they recommend level of care. So they recommend where they're going to place this child. Does this child need inpatient care? Is a day treatment more feasible, or can that child be released to their parent if they're safe enough to be released to the parent, and then followed up with aftercare services?
Thank you.
Thanks, Kelly. And actually, I see a question in the chat, which I think may be answered by this next question. Erin, this question is for you. Erin is from our Beaumont Clinic. So as a follow-up, if my child has made a threat to harm themselves, what can I expect when I go to the emergency room?
So it's scary enough that your child has this threat. So it's good to have an idea of what you could be walking into when you go into the emergency room. And really, when you go in, you're going to tell them why you're there. My child's having thoughts of suicide. And the next few steps is going to look just like a typical ER visit, really. The doctor is going to come in and talk to your child. The nurse is going to take vitals. They're going to go into a room. They're going to get a gown, and then they're going to run labs. Because the immediate thing they want to do is make sure there's nothing medically wrong that is contributing to these thoughts of suicide. This takes some time. The labs are going to go out, and you're going to wonder, why isn't someone else coming in and talking to my child? All this is the medical clearance time. If your child's medically clear, there's nothing medically wrong, then the doctor is going to consult a social worker to come in and talk to you. And the social worker will likely talk with your child by themselves, ask, and you both together, and ask about history of symptoms, family history, what's going on currently, is there safety in the home, is there supervision, all these questions to find out what level of care does your child really need. During this whole visit, you're going to be with your child, and you're going to stay with your child. But as well, there's going to be what they call a sitter, someone who's right outside the room, keeping an eye on your child too, to make sure that they're completely safe. So at this point, you're in a safety zone. Nothing bad's going to happen to your child in the hospital, but they're going to take their time to make sure they get all the information. The social worker is going to meet with the doctor, and then they're going to give you their recommendations. There's a few ways that could go depending on your child's need. They could meet criteria for inpatient care. If it's decided that your child needs inpatient care, you'd stay in the hospital until they were ready to arrange for a bed at another hospital where they receive that care. There's also partial hospitalization. So that's a day program, typical to like school hours. Your child would come home at night, but get intensive therapy during the day. And then there's outpatient, which they would give you some referrals to meet up with an outpatient clinician. And all of the inpatient and the partial are going to all lead to outpatient as well. And it's really, it's based on stability. Are you ready to really utilize outpatient, or do you need a little more at the beginning? Whatever the recommendations are, it's so important that you follow up with them, because treatment doesn't happen in the hospital. It happens outside of the hospital.
And as a follow-up question, if a parent sees their student cutting or any other self-harm behavior, would the parent need to bring them to the emergency room for that?
So it's important that we understand what cutting is. Children are using cutting as a coping mechanism. So they're really in a lot of pain. It's a really negative coping mechanism, right? But the hurt and the pain that they're harboring is they're using cutting to distract them from that. So, a lot of times we hear that sometimes people are cutting for attention or other things like that. And it's important to remember that a healthy person isn't going to cut for attention. This is symptomatic of some deep pain that they're thinking. Doesn't mean that they are suicidal. They don't go hand in hand, but it also doesn't mean that they're not suicidal. So we need to be meeting with our children and asking them if they're suicidal, be upfront, have these deep conversations, listen to what they're saying, because at the end of the day, they really need someone to listen. And, at that point, do they need to go to the ER? It all depends on what comes out of that, right? And if your child is not in a place where they can keep themselves safe, and you think suicide might be on their mind, or they say it is on their mind, then yes. But either way it goes is, this is the time where you definitely need to look into some more help for your child.
And Amanda, just real quick, just to piggyback off what Aaron was saying, if you look at it in the context of suicide versus self-harm, so suicide, self-harm is done to avoid suicide impulses, and suicide attempt is done with the intent to die. So if you look at it like that, just juxtaposition, you can understand the difference in when it's necessary to seek treatment and help, or just to contact someone to kind of help with that youth who is trying to deal with really intense emotions and pain.
Thank you. Kelly, that's a great point. I want to follow up with you on that. So what can a parent expect after the first visit with a clinician? And is a follow-up or is follow-up care necessary?
Absolutely, follow-up care is necessary. We love our kids. We love our clinicians. We love working with youth. I love working with youth. So when you're initially approaching a clinician or approaching a place for services, you have your initial intake appointment. A lot of parents and children get frustrated with that initial appointment because that initial appointment is not therapy. It's just a gathering of information. Sometimes it can take a couple of hours for that initial appointment to get through everything that clinician needs. So they're gathering all this information. They're finding out family history, about medical history, about previous treatment, about signs and symptoms, all these different things. And then they're going to give a provisional diagnosis, and then start scheduling appointments. So that can be really, really important because it's laying the foundation for treatment. Oh, and I'm sorry, Lisa asked about clinicians. So when someone is getting treatment, you have a licensed therapist. They could be a licensed social worker or a licensed counselor. You also have psychologists who also provide treatment, and psychiatrists that provide treatment. Now, the different types of treatment that they provide depends on the setting. For psychiatrists, they are medical doctors that provide medication. And again, that's a whole different assessment and a different appointment, that if that child needs medication, that's a whole different appointment attached to. And in a lot of places, you can only see a psychiatrist when you're also seeing a therapist. You can get appointments where you're just seeing the psychiatrist, but most of the time, most places, you have to see a therapist and a psychiatrist together. They work together. The medication therapy and the talk therapy work together. For a psychologist, they also see patients. They do talk therapy, but they also do certain evaluations and assessments that someone like a social worker or a licensed therapist might not be able or qualified or have the certifications to do. They are someone who you might go see to see if someone's diagnosed on the spectrum or have autism. I know in the schools, and correct me if I'm wrong, for the school systems, a lot of the psychologists will do assessments to do IEPs and to create treatment plans for kids who need support services in the schools. That is not something that I would do as a therapist, outpatient setting therapist. I sit in the IEP meetings, but I would not provide information or assessments in order to coordinate that IEP meeting. And as far as a licensed social worker and a licensed counselor, we like to think that we're friends and that we work together. So some of the social workers on there are laughing because they get this joke. But we do the same thing. We provide talk therapy for our clients. Some social workers and clinicians, social workers, licensed counselors and psychologists have specializations. So if you want treatment for trauma, you might want to go see a clinician who specializes in trauma. or a clinician who specializes in treating people with suicide thoughts or suicidology. So that's really, really important and a great question to ask when you're scheduling appointments or looking for a provider to provide treatment for your kid.
Kelly, are you able to explain, we have Lisa Kennedy is on our panel and she is helping us keep our clinician language to a minimum at times. Can you explain no, that is fine, but can you explain to everyone who exactly clinicians are? What does that term mean?
Oh, so clinicians is like the umbrella term of all those different jobs I just described. Just in general, I say clinicians, we refer to them as clinicians because we do the clinical work, diagnosis, the talk therapy, the prescribing of medications is just one umbrella term.
Great, thanks so much for clarifying that. Next, also for you, Kelly, does most insurance cover these types of visits? And will parents have to pay out of pocket to be seen by a clinician?
So specifically, it would depend on their insurance, what kind of insurance they have, whether they have private insurance or Medicaid. I know payment can be a barrier to services for a lot of parents and for a lot of people, period. They do have this thing called CCBHC, which is a certified clinic behavioral, community certified behavioral health clinic. I have to get the words right. Basically, the federal government said, hey, we have this pot of money. We want to try to remove a lot of access to services. So we're going to give you this money and you're going to become certified as a CCBHC. There was I think 400 plus in the United States that became certified. And this was some years ago, maybe 4 or 5 years ago, maybe a little longer. Higuera is one. There are a few in Wayne County and in the state of Michigan. And the goal is to reduce, access to care. So for example, if someone had Medicaid, they would be eligible for wraparound services through CCBHC. Someone with private insurance or no insurance at all can access those wraparound services. They can access services like being screened at a children's center for crisis without having whether their ability to pay or not. So it's a really, really great program that has been able to remove some of those barriers so that parents don't have to think about paying and more so think about the care of their child.
Thank you. I want to go to Amy from Wayne Westland Community Schools. So Amy, what happens in the school setting if a student makes a threat to harm themselves?
Sure. So it's similar. So Kelly said something that really I resonated with, which is we take any and all threats very seriously. If we hear there's any sort of threat, we will automatically be doing an assessment. So how it all works is the person who first hears the child or the student's threat about wanting to harm themselves, they will contact their administrator, which is normally the principal, vice principal. And then through that, the support staff will be included. And so to break down these words that majority of people are like, what is support staff? So for us, that's our school social workers, school counselors, and our school psychologists. So at least one of the support staff will then sit down with the student and do an evaluation. And by doing that, we do it through an interview. And on that interview, we will ask them a lot of different questions to help assess the risk level that the student has. And the risk level is, which means when we're saying a risk level, it's do they have a plan? Is their plan obtainable? So for example, let's say they're talking about harming themselves via automobile. Now, if a teen tells me that, or even anything along those lines, I would be very concerned. If a preschooler tells me that, and I talk to the parent and I hear, oh, we always keep our car keys locked up, they don't go anywhere else, it changes the whole risk level. Another big thing that Erin said that I also think really resonates within the schools, just in a little bit different of a ways. Erin said that when you're in the ER, you're going to have a sitter outside of the door at all times. In the schools, we will never leave the student alone from the minute that they express the threat until we have completed our whole assessment. That student will be looked after by a staff member at all times. So we will, like I said, we'll do a risk assessment. From that risk assessment, it will help us clinicians figure out what needs to be the next steps. So if we do a risk assessment and we see that there is no risk, we still will contact the parents and let them know that this has gone on, this is what was said, and so that they know that an incident happened today at school and this is how it was handled. Now, if there is additional risks, which could be mild, moderate, and severe, all of that is going to help take us down a different path, which then we will always talk about with the family. So a big thing within the school is we are always in talks with our parents, with our families, with our administration, with support staff. We will even talk with each other. We will hit all levels so that we can get the correct story and we can give the student whatever support they need, as well as give the parents what support and direction they need as well. And a big thing, depending on what risk level they are, a lot of times parents are questioning, like, well, what happens when school hours are over? Because unlike a hospital, you're right, our school hours do end, and we can't keep anyone here 24 hours. And so we in the schools are very, how do I want to say, very like deliberate with how we send our kiddos home. So depending on that risk level, there's a multitude of different options of how that student's going to get home. The biggest thing is if there is any amount of risk, that student will not be sent home without a plan that everyone knows about. So for example, if that means that if there's a high risk and for some reason a parent can't meet us at the school, but they say, okay, I will be at the house, we may send one of the support staff members on the bus. So that way the support staff is right there seeing that the student is now going right to the parent. Or if they're more mild risk, then we would inform the bus driver of what is going on, and the parents would be fully aware of this. And the parent could then meet the student at the bus, which then the bus driver would know who the person is. The biggest thing, like I said, is that we all work together inside the schools, just like in the hospitals. But we do everything possible to, one, assess to see what's going on with our kiddos, and two, to support our parents in every way, shape, and form we can.
Thank you. Let me come back with a follow-up. You really almost touched on some of this, but I'm gonna go ahead and follow up. So what does the school do to support students after the threat of suicide has been made? So how do you support afterwards?
Definitely. So coming from a medical setting, and I went into a school setting, this is one piece that I find is really, really cool. And also I've noticed to be really, really helpful with having a successful return for our students and their parents. So we will do a return to school meeting. We try to do this before the student's first day back. Worst case, we do it in the morning of the first day, but either way, we have a full meeting with the student. It'll normally include support staff, administration, the parent, and the student. From that, we'll review what the discharge paperwork was, if the student had to go to the hospital, if they had to receive a higher level of care like Erin was talking about. And so we'll review that, and then we will collaborate, just like before, with our student, parent, and staff, support staff and admin, on creating a back to school plan for them. And what that could look like is if we see that, wow, they are becoming very, very stressed out when it comes to finals. Well, let's see how we can kind of move that around. Let's see what other supports we can get in. So we really try to ease the high stress that comes from school, which all of us can say that school is a huge stressor for our kiddos. And so we try to make sure that we not only acknowledge that they have really struggled with their mental health, but that it's just as important to us that they feel safe and secure at our school as they do at home.
Thank you.
Thanks, Amy. My next question is for Kelly, again from Hagera. Kelly, what kind of collaboration will take place between a clinic and the school following a situation like that?
Thanks, Amanda. That's a really great question. So when we talk about collaboration, and I just want to point out, Amy has said that we all work together. That is what a collaborative relationship looks like. You know, you have the clinician working with the parents, working with possibly a caseworker or a wraparound facilitator, working with the school counselor, working with the administration in the building, the support staff, just all of those people working together to create that transition back into the school. What that looks like, well, when I've worked with kids as they transition back into the school, inviting their teachers to the treatment planning process, or inviting the administrative staff to regular sessions to talk about triggers, even debriefing with the parents' permission, of course, debriefing staff before the students returns, you know, to talk about what their feelings are, what their thoughts are. Maybe they might have been triggered by the incident with the student. Providing support and training services, additional support for other students who may have questions or may have been triggered. It's really, really important to keep that conversation going. The more people that are involved in the treatment process, the better the outcome. It also empowers parents and teachers to be more active in the process. A lot of times the work is the therapist in the outpatient setting or the school counselor, but the more people that are there to kind of carry the work, you know, the better the outcome for the student.
Thanks, Kelly. Next, we're gonna go to Jerry, our school psychologist from our district. Jerry, can you please tell us a little bit more about Care Solace, which is a new and free service to our Wayne Westland Community School family?
Certainly. So Care Solace is a tool for connecting students, staff, and their families to care. This service is free to all Wayne Westland Community School students, their families, as well as our staff and their families. So Care Solace takes the burden off an individual's plate of trying to find a clinician on their own. So Care Solace will quickly and confidently find available mental health and substance use providers matched to a person's needs. So this means that they will call the providers on your behalf, verify insurance, and help you make an appointment. Care Solace will connect the caller to care with any insurance coverage, including Medicaid, Medicare, and a sliding scale option for those without insurance. Care Solace is available 24 hours a day, 7 days a week, 365 days a year, and can provide support in over 200 languages. So in order to get connected to Care today, you can call 1-888-515-0595 or go to their website, caresolace.com/WWCSD. There is a live video chat option that's also available in order to set up an appointment. Wayne Westland Community Schools mental health staff are also able to make a direct referral to Care Solace, and this is called a warm handoff. So if we are contacted by a parent in order to make a referral, we can do all that and connect you with Care Solace. Once the referral is complete, Care Solace will reach out to the family and often within the hour, get the process started with you. So please reach out to your student's building principal if you would like us to complete a referral form for you. The process is very simple, it's fast and free.
Thanks so much, Jerry. I want to come back with another question. So can you explain the difference between when you call Care Solace and when you would call the National Suicide Prevention Lifeline? Can you speak to that?
Absolutely. So Care Solace is not an emergency service for suicide prevention, but it's rather a service to connect families to a clinician. So either before they're in crisis or after being released from a hospital following thoughts of suicide or a suicide attempt. So in the event that there's a life-threatening emergency, you would want to call 911 or call the National Suicide Prevention Lifeline. And that number is 1-800-273-8255. And the National Suicide Prevention Lifeline, that's where you would call in the case of suicidal concern. So it's a national network of local crisis centers, and it provides free and confidential emotional support to people that are either in suicidal crisis or emotional distress. They're available, again, 24 hours a day, 7 days a week, 365 days a year in the United States. They can connect you with prevention resources for you or your loved ones. They also offer the best practices and resources for mental health professionals in the United States. So, even if you're not in crisis, but you have some questions on wanting to help someone who maybe, that's a great number to call.
Thanks, Jerry. Following our mental health symposium this evening, Hygera Health will be offering a free training for Wayne Westland Community School parents, guardians, and caregivers in QPR, which stands for Question, Persuade, Refer. This is the same training that our school staff have received to help prevent suicide and connect those in care. Kelly from Hygera, you will be hosting this specific training. Can you give us some more information about what QPR is and what parents can expect during this training?
Sure. So QPR stands for Question, Persuade, Refer, which are the 3 steps that you take and that a gatekeeper, so when you take the training, you'll be trained as a QPR gatekeeper. And we'll teach you those 3 steps to take to help someone transition out of a suicide crisis. Those steps are to recognize the warning signs of suicide, to know how to offer hope, and to know how to get help and save lives. So ask a suicide question, persuade someone to live, and then refer them to services. Again, it's help. We're going to do it virtually. It's free. We're offering it free. All they have to do is email me. This is evidence-based, so meaning it's been researched, it's been proven to work. 1 in 10 people that have used it and saved a life. Do we want to get to the space where I don't have to do this training anymore? Absolutely. That is my hope and my goal, why I work so hard doing this. Anyone can be trained as a gatekeeper. And I've trained, again, educators, I've trained clinicians, I've trained some of everyone. And every time I train, each training, I usually get at least 1 person who calls or emails, or I run into and say, thankfully, I used this to save a friend or a student or a loved one. So it works. It's really valuable information to have.
Thank you.
One thing I just wanted to add is that last year, all of our teaching staff was trained in QPR. So sometimes, as a parent or guardian, you may have your son or daughter come home and say, my friend was talking about hurting themselves or things like that. So I would recommend either you contact the school or have your son and daughter go to a trusted adult in the school and have them reach out so that they can get the support to help that friend. The worst thing is just, keeping a secret about somebody that wants to hurt themselves, and it's better to, save a friend's life than have them, just be mad at you, so we really need to, have them go out and talk to a trusted adult and get the help.
And to real quick to piggyback on what Jerry just said, is one thing that I definitely forgot to add is as a support staff, that if a child or a student has made a threat that they wanted to harm themselves and there were other children around, we do support, of course, varying for the different ages. So if you have a middle schooler, high schooler that comes home to you and is like, hey, like this student, this friend has made a threat of wanting to harm themselves today. And if you either don't feel comfortable with that conversation, you don't know how to handle that conversation, or you really would like your kid to get more support, you contact your school, and us support staff are also there for all of our other kids who have experienced it, because that is a really difficult thing for anyone of any age to hear, let alone, our students.
I have one more follow-up question to Kelly for you from the chat. Who are good candidates to take the QPR training?
Anyone, everyone. Suicide prevention is not just for clinicians. We need everyone. It's a grassroots effort. It could be someone's coach or someone's pastor or someone's rabbi. It could be someone's aunt, that support person, someone's parapro. Anyone can be trained in it. I only see the clients or the kids after the suicide crisis. After they've been discharged, I see they have the initial appointment. I would love that intervention is in place and someone is there before the attempt is made or before the attempt with injury has been made. It's an amazing training program, and it just gives you those really practical tools, on top of which we do education piece where we talk about suicide and some common things about suicide, so that participants are really comfortable in leaving in there with their tools. And then we provide, if any follow-up trainings or any follow-up support, I'm available to talk to our participants after they get trained. I talk to you a lot, Amanda.
I think you don't even need to be in a role of any, like a positioner. I mean, even a neighbor, person down the street, just anybody that has contact with kids or things like that. And you can actually just ask them, hey, what's going on? Because you never know who you can help just by, spending a few minutes talking to somebody.
What we know about suicide is that when kids are straight up asked about it, they often answer really honestly.
Mm.
And then we can get them help. So anyone can help. Everyone should help, and don't be afraid to ask those questions, because when you get the answer, when they open up and they tell you, that's good. Now you can help. Before you didn't know.
And we'll just say that statistically, 90% of people show warning signs of suicide in a week preceding the attempt. So there are signs out there. And if people are trained to recognize those signs, which QPR does, it can be really impactful.
Thank you.
The other thing I just want to add too about QPR is, for anyone interested in taking that training, is that while our focus this evening is on our students, our youth, QPR is a method that can be used with a person of any age. So like we were talking about this evening, it could be a spouse, it could be another family member, a friend, that you would then use those skills that you learned in that training. So please, if you are interested, you would contact Kelly Mays. Her email address is on the screen, and we look forward to having you attend that training, and it's free.
All right. So with that being said, we'll go ahead and are there additional questions for our panel in the chat and the Q&A? We're going to ask our communications director, Jenny Johnson, to help us with that portion of the session. And then also all of the panel members, feel free to respond.
Okay, Amanda, do you want to ask the questions? I sent you, I think there was 3 questions so far. Do you want to ask them?
Sure, I can ask the questions. All right, so our first question is, has there been an increase in youth suicide in the African-American community during the pandemic and over the last 2.5 to 3 years? With so many pressures already affecting this youth demographic, I can't help but wonder. My son is now 14 years old, and I listen to him when he talks to me. And every time he says, "Hey, Mom, can I talk to you about something?" Some of the pressures of this current generation just seem different and more intense than before. Would anyone like to jump in and answer that question?
So, I'll give my take. When you talk about suicide rates, overall suicide rates are going down. I think they've been down 3% since 2019. However, in specific populations, specifically in BIPOC populations and in Black youth populations, those numbers are increasing. Why that is, there is a host of reasons. And Right now, the goal is to gear training, funding, and support towards those special populations to get those numbers down, to support parents, to support kids. What I'm seeing is that parents are looking for clinicians who specialize in suicidology. They're looking for clinicians that have those cultural nuances or understand those cultural nuances, so they can talk about the things that are stressing out or distressing youth in that population. What is needed? Definitely more research, definitely more support, lots of education for both the community members, parents, and kids, and more programs to support kids. There's not a lot of things out there for these kids to say, hey, this happened to me. Hey, what's going on? You know, when I look in the TV, I see these images and I can't process them as easy as I could 5 years ago. You have to understand there are things that kids see on, they'll turn on TikTok and see things. And then they'll turn on Instagram and see things. They don't look at Facebook. Facebook's for old people. But you know, they go and then they turn on their TVs and see things. They turn on YouTube and see things. And that constant exposure to those things can be very distressful. On top of that, they're dealing with other things, being our new normal for the pandemic. And it can be really distressful. I think that definitely having programs geared specifically towards specific populations that are seeing that increase is really helpful. Again, QPR is something that can be utilized no matter what the demographic is, but having that support and having those programs that are geared towards those populations can be really helpful and impactful. And I've seen it in practice.
And I think the one thing that, you know, I feel is really important to touch on for this parent and so many other parents is the one thing this parent said is, you know, I try at all times that if my student says, hey, mom, I want to talk, I try to put down everything and talk. And I think that that is a beautiful, even just effort as a parent to put out. I'm a parent and I know that if I'm cooking dinner and my phone is ringing, I have 100 things going on, I have a hard time putting things down. And so as parents, we are so rough on ourselves sometimes. And so I just want to say that to that parent that one, it's so beautiful that you do find this very important. And two, if there are times where your son wants to talk to you and you are super busy, or maybe there's something going on where you are just feeling like you don't have capacity to talk in that immediate moment, being okay with acknowledging your kids need to talk, but also being honest and saying, you know what, right now I can't talk. Just and if you want to keep your kid next to you or encourage them to write, that's great. But we also have to be kind to ourselves as parents too.
Great, thank you, both of you, for answering that question. Our next question is, how should we handle a situation when and if our children come to us about a friend who's having trouble coping? What is the best approach? Anybody want to take that one?
Well, I'll take that one. I think, again, keeping the lines of communication open and the fact that they came to you to tell you that is a good indicator that they're seeking help. I think, you know, always feel free to contact the school because we do have people available there. Our mental health staff in the buildings are able to meet with students, figure out what's going on. If you do need to follow up and need a referral, we can do a warm handoff with Care Solace. I mean, that can get the ball rolling where we can get you in touch with actual a therapist, client, you know, clinician relationship. So letting the school know right away, I think would be the first step in getting help.
You can also talk to the child's parent. I mean, you know, we're all in this together as parents, and it really does take a village. And if my child was struggling, boy, I hope someone would let me know. So as scary as a conversation is it is, it's got to happen.
And I know there's that fear of, you know, if I tell my child's friend's parent, well, then my child's going to be upset with me or something along those lines. I always encourage that when it comes to a child's safety, and that definitely includes, you know, suicidal thoughts, we have to do what's best for our kids and then our kids' friends and community and all of that, which is make sure they're safe. And having an honest conversation with your kid as to why, this is just not a secret that, mom can keep. Mom has to reach out, and this is the reason.
It's a great moment for empowerment, telling your son, wow, that was really brave of you to come to me, and you trust me to help you, and we're going to do it together. We're going to help your friend. It's a great moment to empower your child.
And just to add on to what Erin and Amy were talking about, that as parents, and I'm talking clinician hat aside, as parents, we don't have all the answers. And that's okay to tell your kid, hey, I don't have all the answers, but together we can figure this out. We want to support your friends. And also, what I think the saying goes, it's okay to not be okay, but it's not okay to stay that way. And that your friends in this space where they're not doing the best. So let's work on that, on how to get that person out of there. And then lean on your village. There's so much support from schools that they provide to help parents and to help kids, so lean on your village, lean on your friends, lean on your family members, lean on your school to help with that transition process and to help connect and link with resources. I know for me, I look to my school social worker, my daughter's school social worker often. She's amazing. And she can think in spaces where I can't think as a parent, because my concern is getting my child healthy and in a safe and well space.
Awesome. Thank you, all of you, for chiming in on that one. Let me see. Where would individuals outside of our district go for resources? Because I know we have Care Solace within Wayne Westland, but are there other places that individuals can go outside of our district?
Of course. So with, Medicaid, private insurance, mental health services are there. And so if the National Suicide Hotline, that's not just for Wayne Westland. That is for, like Jerry said, the entire country. So that is one that's always available. I believe Kelly brought up the Children's Center, Crisis Center. Again, that's not just Wayne Westland kids. That is for everyone. Emergency rooms, those are for everyone. And then if we want to talk about, maybe we don't have such a high threat level or high risk level, but we want to get our kids help. All of these agencies, Hagera, Beaumont, they don't just accept Wayne Westland kiddos. It's something that you can very much obtain, and it can be done in multiple different ways, including one way is you call the number on the back of your insurance card. You'll be connected with a representative. They'll ask what you need a referral to, and you'll say mental health services and you'll give the age of your kid or yourself. And they'll give you a ton of different referrals with phone numbers that you have to do a little bit more legwork on, where Care Solace does more of that legwork. But I promise you, it is a lot more streamlined than it used to be even 5-10 years ago.
Yeah, I would also recommend whichever district you're associated with, calling that school district, because they do have relationships just like we do. So each school district should be equipped to have some resources available. You can also dial Michigan 211, depending on the nature of the service you need, and let them know what you're looking for, and they will be able to connect you with a variety of different services.
And I want to remind, parents that it's often really scary to start therapy for anyone, right? Like nobody wants to do that. You want to get better, but it's a lot of work. It's a lot of work. It's a scary thing. And in all honesty, sometimes it might take a little time for you to get into an appointment, for your child to get into an appointment. And during that time, you might think, well, things are better. They say they're feeling better. Please follow up. Please make a connection. Even if they go just a couple times, at least you started the process. You have a connection. And for kids who don't want to go to therapy, please go with them, introduce it to them. I would say, honestly, the majority of my clients are like, I don't think that's for me. I don't really want to do that. No, I'm like, well, let's just talk for a second. And I just get to know you. And they leave coming, wanting to come back for follow-up. They just need to feel comfortable. Let's give them that opportunity.
And sometimes it takes more than one therapist. I mean, you may need to shop around and find a therapist that connects well and fits well with what you feel is right for your child, So, I mean, there's no harm in changing therapists until you find someone that's working for you.
There isn't, and do it if it's not the right person, because right now, as a youth and a teenager, this is a really great time to start working through this stuff.
And to piggyback on what Erin said, she said, go with your kid to therapy. It even starts before that. We also, as parents or aunts, uncles, anyone surrounding the kid, is that we want to be talking positively about getting mental health services. If your child has heard, their whole life that you're weak if you have to get mental health services, and you're weak if you're depressed or sad, well, you're like more likely that child is really going to struggle with being like, oh, okay, so I should go get services. We want to start from the beginning that the narrative is, just like if you broke your arm, we wouldn't say you're weak to go to the emergency room, right? Or you're weak for wearing a cast. It's the same thing for mental health. And then the one other place, I'm sorry, I forgot, is also your kid's primary care doctor. You don't have to wait for their yearly checkup. You can call the office at any time as well as coming to your school. You can call the office at any time and express your concern, and they will also have referrals for you.
I have another question. So this one says, do you feel that social media is a factor with both youth and adult suicide? Anyone want to take that one?
Well, I would say that it causes some issues where people broadcast the good things in their life. And then other people see that and they expect, well, my life should be at that level. So I think it gives people a false sense of reality. Not everybody is happy and experiencing all these wonderful things throughout their day. And if you're living your life to that high expectation, I think it leads to some issues where, you're going to feel some distress and feelings about you're not as good as other people around you. So I think that may cause some concern.
Social media is incredibly addictive. So, we see our kids staying up all night. It's going to lead to a lot of problems. They can't, then they have to get up for school. They can't perform in school. Anxiety starts. And also then being on social media, then withdrawing from those other things that they really enjoy that at the end of the day are really therapeutic. Maybe they're great artists and they're not doing their art anymore because they have to know what's going on all the time.
So here's my thoughts. This is a very prickly question. In that, does one suicide influence the other? But more so, let's just talk about social media in general and its influences on behavior. There is a lot of things on social media that our kids are exposed to. I was just doing a training in my QPR training. I talk about bullying behavior, exposure to bullying behavior. Now, when I went to school, like long ago, we used stone tablets, to do our homework lessons. My bully stayed at home. At the school. My bully did not follow me home. Nowadays, kids have access 24 hours, 7 day a week access to their bullies. And they don't have to even know their bullies. Their bullies could be someone who lives across the world, or be a fake profile. And that increased exposure to that bullying behavior, or increased exposure to graphic content, those kind of things can cause a lot of distress and can lead to someone being in a suicidal crisis. However, you have to look at other things too. What are the risk factors that are present in that person? What other kind of things are going on? Those are the things, what kind of protective factors? And protective factors are things that are already present that help that person's distress lower. So what kind of other things are present that would cause that person to go into a suicidal crisis? So it's kind of I would say case by case basis to look at that individual and their response to social media versus looking at social media as a whole and how it influences someone's behavior, if that makes sense.
And I would also piggyback on Kelly in the way of what I hear a lot of times, especially with my alternative high school students, is that social media is actually something that has brought some of their kids outside of their shell, or some of their kids who felt like they have never belonged before now feel like they belong because there's some type group on some type social media that they really relate to. And so the positive and the power that comes from social media, it's really important to note that. But just like everything else in life, we have to make sure that we are trying the absolute best as parents to give variety and to give balance is really what it is. And that's, something that not only do a lot of us parents struggle with on our own, but then to teach it to our kids is really difficult. But that's really, I think, a very important thing when it comes to our students in social media.
Awesome. So I have another question. This one is about Care Solace. And this individual would like to know, is Care Solace only available through a Wayne Westland referral? And I believe this means the warm handoff. So what are the different ways that a person can access Care Solace?
So Care Solace, if you're going to do a warm handoff, that would be our district staff. So we would go ahead and make the contact along with the parent and let them know that we are going to be giving them the information to start that process. Outside of our district, there is a 1-800 number to call. And if you call that information, you can get that referral set up. You would call directly the 1-800-273. I'm sorry. Care Solace number 1-888-515-0595. So that's the number to contact Care Solace directly for making a referral that's not related to the district.
You can also access Care Solace if you would like to do so privately and not give any identifiable information. You can go to the Care Solace website that is designated for our district, which is careSolace.com/WWCSD, D as in dog. So those three ways again are, you can have a mental health staff person at our school district make a referral. You can contact Care Solace directly, or you can search on our designated website, and no identifiable information is collected on that website. They just search your zip code, what type of insurance you have, so that they can search a provider who is within your area. But you are not entering names, you are not entering birth date, none of that. And then someone asks as a follow-up, it says, we are out of district, does that matter for Care Solace? As long as you are a Wayne Westland community school family, if you are out of district, you can still use that service. Let me see. I believe that is our last question. So I'm going to turn it over at this time to Daryl, and thank you to everybody who submitted your questions this evening and to all of our panelists who answered them so wonderfully. Oh, Daryl, you're on mute.
That'll do it. All right. So once again, we want to thank everyone, all of our panelists and their organizations. Kelly from Hagera Health, Aaron from Beaumont, Lisa from the Rotary Club of Canton, and Amy and Jerry from Wayne Westland Community Schools. I also want to thank Patrick for bravely sharing his lived experience with suicide. So once again, thank you everyone for tuning in. Please remember, if you or someone who is at risk of suicide, or you know someone who is at risk of suicide, please reach out to the National Suicide Prevention Lifeline at 1-800-273-8255. Help is available 24 hours a day, 7 days a week, and 365 days a year. So once again, thank you all and have a good night.